Well, I think this situation has changed everything for everybody, including us. And so we are doing a lot of things differently. We're screening patients when we call them to confirm their appointments. We're asking them about fever. We're asking them about cough, shortness of breath, muscle aches. If they've had high risk exposures to people that have had the infection or have recently traveled to or been with people who have traveled to high risk areas. So that's all new. We're not having patients come directly into the clinic when they arrive. Rather, when they arrive, they call us and let us know they're here. And then we go out and get them when the room is ready. And when I say the room is ready, we've had a patient in there, and before we bring the next patient in, everything's thoroughly wiped down and sanitized so that it's a clean room when they come in. So all of that is, I mean, we always wiped our rooms down before, but they're going next level on wiping things down. So that's all very different. We're trying to triage patients, patients who have conditions that can safely wait a little while. We're if they want to, and it's appropriate, we're allowing them to safely wait. But we also have options to see them. We have telehealth. So just like you and I are talking right now, I can have a visit with a patient. And this works really well for patients who have like acne, psoriasis, eczema, conditions where really we kind of want a global view of, is it worsening? Is it improving? How are you tolerating treatments? I can interact with the patient. I can hear what they're saying and see their facial expressions to really see if they have concerns that are not expressing verbally, but that are in their eyes. I can see that. And so that works well. The place where it gets difficult to do what we typically do is we do a lot of procedures, whether it's something as simple as freezing a wart or removing a concerning mole. I can't do that through this.
Through the internet, no.
Yeah, but if you have a mole that you're worried about, sometimes the imaging through this system is good enough that I can look at it and tell you, look, we do need to get you in right away. We need to take a biopsy, or I can look at it and go, that looks okay. Let's wait a couple months and have you come in when things are safer, and we'll take a look at it. So that works for that. But we certainly have patients that have skin cancer that can't wait, and we're still here. We're getting them taken care of, and we have other patients who, you know, quite honestly, just really want to see us. They're concerned, and we don't want somebody going to the emergency room or an urgent care center who has a bad rash or a worsening skin condition, when it's much safer for them to come here and see us here. So we're still here. We're open. We're working with a lot of the other thing that we're doing a lot differently now is a lot of consulting doctors will call us and send us images and ask us questions over the phone or teleconferencing like this about their patients, as opposed to sending their patients right over. So we're trying to accommodate our colleagues too, who are in situations just like us. So.
Okay, so here's a question for you. You know, we're coming up on the get outside and get outdoors season, and a lot of people are going to be outside. And what should they look for? Like, you know, if they do get, you know, melanoma, or if they do have a concern, what should they look for in order to say, maybe I need to make a phone call to the Skin Institute?
Well, so number one, yeah, get outside. I mean, it's really good for your mental health, especially right now where we're all cooped up. Do it safely, practice social distancing. If you touch items, be sure to wash your hands, everything that we're being told to do. But I would encourage you to get outside. And then I'm going to add to that to wear your sunblock, you know, SPF 30 or greater. Try to apply it about 10 or 15 minutes before you go out, and reapply it every, you know, couple hours if you stay out that long. And then, you know, wear some protective clothing and things like that. But as far as what to watch for, so when we say skin cancer, for me, that encompasses a whole range of different types of cancer. And the most common types of skin cancer do not present like a changing mole. Now, that's melanoma skin cancer when we think about a changing mole. But the more common types of skin cancer will present typically in sun-exposed areas, so like your hands, your ears, your scalp, your face, your arms, and they'll present typically as sores that won't heal. So if you think you've gotten a scratch, or maybe you think you have a pimple, but it doesn't act like your normal scratch, your normal pimple, it just festers and festers and won't heal or go away, that should worry you, and we should check that. And then, of course, melanoma. If you see a new dark spot on your skin, look at your other dark spots and compare what you think is new to the others that you have. If it looks a lot like the others that you have and it's not really changing quickly, it's probably okay. But if it doesn't look or act like any other spots that you have, it's probably not okay. I always say the good guys have friends, the bad guys don't. So if it doesn't have any friends that look like it, then, and especially if it's growing quickly, if it's changing colors, if it's bleeding, if it itches, it burns, it stings, that's not normal. And you should definitely have us look at it. And we could do
Okay.
that via telehealth. You could send us a picture, we could talk, and I could look at it, and we could tell you, you know what, let's get you in right away, or I think you're okay, we can wait. We can do that.
All right. Thank you very much, Dr. Stoddard. Thank you for taking the time. And if people do have questions, how do they get a hold of your clinic?
So just call us. We have people answering the phone, setting up appointments. You can certainly send us messages too, but calling's the easiest, simplest way to get you scheduled. We're here.
Okay. Thank you very much.
All right. Thanks, Matt. Take care.